enter the room.
Hello, my name is Anam Khan and my GMC number is 8053887. Shall I proceed?
Please proceed.
Thank you so much. Hello, I'm Dr. Khan, one of the doctors here. Are you Hannah there?
Yes, doctor.
Can you confirm her full name for me, please?
Mine or Hannah's?
Your child, Hannah's full name.
She's Hannah Wilson.
Thank you. And her age?
She's 5.
5 years old. Thank you so much. So, I understand that you're here to learn about how to use EpiPen that has been prescribed to her. Is that right?
Yes, doctor. I mean, Hannah just had another anaphylactic attack today, and I'm really worried about, what I can do. At this time, also, I just couldn't do then. So I was hoping if you could, teach me how to use it.
Of course, I can help you. I'm glad that you're here. That's very important, and I'll try to leave you confident about what to do when it happens again. So, you told me that this happened before as well, is it?
Yes, doctor.
So, what were the symptoms that happened today?
Well, the first time she was at a friend's birthday party, and she had this attack where she ate the birthday cake, and then she found it difficult to breathe. There was like a whistling sound, and she was complaining of her tongue feeling itchy. So that's when we knew that she had this peanut allergy.
So she got a peanut allergy. Yeah. So yes, the sweet allergic reaction does occur after that. You're right. So, how did the hospital visit go on? How is she doing now? She all right now?
Now, yeah, she's all right. We are ready for discharge. But
yeah, that's good. That's good. So, are you happy with the care provided? Any complaints, anything like that that you want to share?
No, doctor. I just want to learn how to use this EpiPen. This time also when it happened, I mean, I was told how to use it, but I just don't remember how to, and I don't want to make that mistake again.
All right, that's fine. So, today we are going to learn how to use the EpiPen and when to use it, how to use it, and what to do afterwards. We'll go at your pace, and you feel free to stop me anytime, and if you want me to repeat anything, and if we need to pause, or in case we get interrupted, I make sure that I arrange another session with you or send you a reliable link that you can read on later on. Sounds good?
Yeah, sure, doctor.
So shall we begin?
Yeah, please.
So, EpiPen is basically the thing that is in front of you. We also have a you'll also get to practice with the pen here. We have it for you. So this is the thing that we call adrenaline kit, and it has got 2 pens in it and 1 chlorpheniramine tablet that you can use. This is antihistamine that we use in the anaphylactic reactions. So when do we use it? There are a few symptoms that I'm going to tell you, and whenever you spot 2 or more of them together, you have to use the pen. So what are those symptoms? Let me tell you. Sudden difficulty in breathing, or wheezing that you told me that happened to her before as well. Then any swelling of the face, any swelling of the lips, and swelling of the throat, or maybe a widespread body rash, or fainting or confusion, and like a feeling that something's really wrong, and the child is really unwell. So 2 or more symptoms together, you have to use it. Even if you're not sure, you have to use it because it's always safe to use it. So do you feel comfortable, that you feel confident that you'll be able to spot the symptoms now?
But what happens if she doesn't have the allergy? What if I give the medicine if she doesn't have the allergy?
No matter, it is always, like I said, it's always safe to use it even if you're not sure. Okay, because this adrenaline thing, the medicine that we have in the EpiPen, it can cause shaking maybe, or pounding of the heart, and it goes on after some it goes off after some time. So it's safe to use it even if you're unsure about the symptoms. Is that okay?
Okay. Yeah.
Yes. So this is the EpiPen, and you have to hold the EpiPen. It has got two in your hand, the dominant hand, and it has got two ends. One is the blue and one is the orange. So blue, the sky, always up, and the orange side will always be the down. So you have to keep in mind a mnemonic for it. Blue to the sky and orange to the thigh. Okay, sounds good?
Yeah, yeah, that's pretty helpful.
So you never have to cover any of the ends of it, because orange part is one from the where the needle comes out. So this you don't really see the needle.
2 minutes remaining.
Because it's spring loaded, so it'll go back itself. So you have to hold it in your dominant hand, and you have to swing and pull it in the upper third of your thigh, of like the patient's thigh or your child's thigh, and hold, and you listen to a click. Hold it there. When you listen to the click, it means the medicine has gone through. So keep it there for 10 minutes or 10 seconds, sorry. Count slowly, 1 elephant, 2 elephant, up to 10, and then take it back, take it out. So after taking it out, just gently massage the area and take the phone out and call 999 and clearly say the word anaphylaxis for the quick ambulance response. So are we good now? Are you following me so far?
Yeah, yeah. But can I give it through clothes? What if she's wearing some thick jeans? Can I still give it?
Yes, make sure there's no pocket, but it does work if you're wearing the single layer of the clothes. That's fine. It works. It goes through the clothing, so that's fine if she's wearing it. Yeah. So
Yeah.
that's how we use it. Is there anything that you want me to repeat?
Yeah, I guess I got it so far.
Yes, always check the expiry date. I'll set a reminder for the prescription renewal so that it doesn't expire, and always keep this kit with you wherever you go, okay? Because it's really important. And always wear that bracelet, allergy bracelet that we have given to you. Make sure he wears it everywhere, okay?
Okay, yeah.
And one other thing is that I appreciate that you came here. You seem to be a really caring mother. You came here and you learned that. And if there is any information that you needed, we have here a leaflet as well.
Move on to the next station.
All right, doctor. Good job. So I'd like to ask you a few things.
Yeah.
So did you understand if the mother understood anything? Like, how can you be sure that the mother has understood everything that you taught her?
I don't know.
Yeah. So, always, whenever you're doing a teaching station, always try to gauge understanding. So, the best way to gauge understanding is after you give a chunk of information, try to ask them to repeat it. All right.
Okay.
That's when you actually know that they've actually understood what you're trying to say. And most of the times, when you're doing this, the patient would make a mistake. All right. So the examiner wants to see how you address any mistakes. You know, do you actually address the fact that it's wrong, that what you've understood is wrong, and you rectify it? You know, that's very important. That's one of the aspects of teaching that they're trying to assess you on whether or not you assess their knowledge, you understand if they have understood things correctly, and if they haven't, how do you approach that? All right. So always try to assess knowledge. So every time when you're talking, make it like a conversation. You know, after you give like a big piece of information, always try to check knowledge. Check knowledge at least thrice, right?
Yeah, I should also have asked her that if she wants to practice one more time with the trainer pen that we have.
Most of the times, you know, you wouldn't be required to ask the patient or whoever is learning to demonstrate it, right? You'll have to demonstrate it yourself and just ask questions, right? So that you can gauge knowledge that way, right? But most of the time, you will not be asking them to, do any examination or demonstrate any procedures. You will be the one doing it, and they'll just be, observing.
Okay, yeah.
So yes, that was one thing. And the other important thing that you missed, I would say, is how do you act? Is every EpiPen with blue and orange side, is it all active? If you just jab it, will the needle come out?
No, you have to take the safety cap out.
Exactly. Did you mention that?
Yeah, I didn't.
Right. So
Yeah.
important steps. So don't forget that, because unless you actually take out the safety, it won't get active, right? So even if it will happen. What if it doesn't work the first time? Are you sure that every single dose of adrenaline? So whenever you're using words like adrenaline and all that, make sure to follow it up with a layman explanation. You can use medical jargon, but when you're using medical jargon, always follow it up with a layman explanation, especially important areas where you have to use medical jargon, like what is this medication, what is the condition that the patient is having, right? Always follow it up with some kind of a layman explanation, right? Don't leave it hanging with the jargon. First of all, they won't even understand what the word that you used. They won't even remember it, right? So the purpose is kind of defeated, right?
Yeah. Okay.
So apart from that, yes, in the procedure, you'll have to use 2 pens. What is the importance of using 2 pens?
2 pens, because if the symptoms don't get good with first pen, then just wait and give it another dose after 5 minutes. If the medical help doesn't see, do it again after 10 minutes. Yeah, so.
Exactly. So basically, you can administer 2 doses, from the patient's side, and that's what. And in the meantime, you'll be calling for the ambulance after administering the first dose. If the symptoms don't subside, then you administer the second dose in 5 to 10 minutes, right? Otherwise, it was pretty good, doctor. A couple of things that I would mention is that you have to do data gathering, right? So at this point, you don't. I mean, I did mention peanut allergy. Apart from that, you didn't establish the history properly. You understood that there was a previous episode, but what were the symptoms in the previous episode? What are the symptoms in this time's episode, right? Any other history that they might be having, asthma or any medical history that you want to rule out, right?
I missed a lot of things, yeah.
One important thing that you have to understand, especially when it comes to allergies, is where all does the child go? Like apart from home, where are other places where she spends majority of her time? That's very important, because you will have to give them a set of what we'll say, the allergy kit.
Because like if she's going to the school, make sure the teachers know it, right? Are you trying to tell this to me?
Yes, exactly.
Yeah, okay, I get it.
Very important. So you need to understand in the history itself where is the majority of time spent on this, right? To understand where all you need to be informing about this allergy, right? And instead of actually mentioning that please wear the safety bracelet, offer it. Like, I'm going to be giving you a safety bracelet that will mention peanut allergy. Like, explain the purpose of that, right? So that if this happens again, it would be easily identified as an allergy, right?
Okay, yeah.
All right, so let's quickly look at the scores. So good job. So data gathering was done well. Greet Mrs. Wilson and introduce yourself as the FY2 doctor, right? Identifiers, Hannah's full name and age. Also confirm the relation of the mother. So who are you talking to? Is this the mother? Is this another relative? Is this an aunt, right?
Yeah.
Sorry. Yeah, sorry, this is the list. Yeah, so you need to understand what the relation is. Who are you talking to? Because these are, conversations you'll be documenting. That I explained the whole procedure to who exactly, right? And what is the relationship to the patient? So you need to understand in this entire scenario who is your patient and who are you talking to and their relation, right? So great, Mrs. Wilson, introduce yourself as the FI2 doctor. Patient identifiers, full name and relation with Hannah and her age. Confirm the the visit and the current symptoms. Gather event details. Could you please describe what happened today? So incident history is very important. So try to understand the sequence of events that has happened, what she was able to do and what she was not able to do. So your management will consist of the areas where she was lacking. So you would understand that she understands how to identify when there is an anaphylaxis. You will be supplementing a couple of more symptoms for her to understand. And then you will be telling her when to use the pen. So that's when she doesn't know what to do, right? So to identify where is the lack of knowledge is also, you know, very. All right, so gather detailed history. Could you please describe what happened today, previous episode, and management? Can you please tell me about the previous episode? So now you have two incidences. So now you can also get a better understanding of what she has learned in the two subsequent, you know, incidences and how she was able to react, so that you can give her, you know, tips on how to react, what to identify, and you know, and most importantly, how to use the EpiPen itself, right? Confirm whether EpiPen was used previously and today. Explore barriers if not, because that's exactly what you're trying to understand. Where are you? Why is the reason we are not able to use it? So that you can address that fact, right? You can somehow address the barriers. Identify current concerns with EpiPen usage. Ask about other medical conditions or regular medications. Inquire about other known allergies. Ask about handling disease such as school or other caregivers to understand exactly where she spends majority of her time. General health, immunization, development, bowel, bladder. That is, you know, if you have time. That's not the best time. Aspects that you may while jumping into treatment. So good job on the overview. I really like the way you mentioned the overview. So we're going to be talking about, so you kind of gave an overview, because most of the teaching stations, let me tell you, you most likely will not be able to finish it because it's going to go into a conversation, right? So if you notice that you're speaking for more than 1 minute, that means you've lost the station. It needs to be a conversation. So after you give the patient a chunk of information, you need to, or if it's a colleague or a staff member, after you give them a chunk of information, understand whether they have managed to understand what you're trying to relate to them, right? And that fits into a conversation. That's why you brought in the fact that if in case we don't finish, we will set up an appointment to make sure that you've understood the procedures well, right? So that is safety netted and followed up right at the beginning, and that's kind of really important for these kind of stations. But yeah, good job on doing that, I have to say. So so explain the signs of anaphylaxis. So you started with that, good job. So, you know, appreciate the fact that she knows a couple of them and supplement the others, you know, like a rash, hoarseness, right? So just there are a few more that I'd like to let you know of. If you do notice them, you know, be suspicious of you know, an allergic reaction, right?
Yeah.
EpiPen instructions demonstrate the correct usage of EpiPen. Safety cap, blue to the sky, orange to the thigh. Jab orange tip into thigh. Click sound, hold for 3 seconds. Post EpiPen procedure, after using the EpiPen, always call 999 and inform them that it is an anaphylactic reaction for the very good. Clarify EpiPen safety when a non-anaphylactic reaction happens, right? So this medicine, which is adrenaline, it not only combats any of the allergy that the that your child might be experiencing, but if in case where there is no allergy, you know, it would have it would only cause you know, small responses like increase in heart rate, or you know, increased sweating. So, but that's completely normal. It will pass in a few minutes, right? Because the dose is very low. You know, excess side effects. Clarify the safety of non-anaphylactic. Mention that. Explain checking expiry of EpiPen fluid monthly. That's very important, and also the clarity of the fluid. If you see that it's the fluid, there will be a safety window through which you can see the fluid. So if you see that the fluid is turbid, or if you see any particles, please make sure to exchange the pen, right? Recommend allergy bracelet. So at this point, you don't even know if the patient has the bracelet. So don't assume anything, don't assume that she might have it. Offer it. I'd also like to offer an allergy bracelet, right? So next, partially covered. Further management, always carry 2 EpiPens and an antihistamine. So that's a part of the kit itself. Like explain why exactly is 2 important, right? Long-term management, emphasize carry 2 EpiPen, antihistamine, and give the same to the school as well as other places that the child spends time. That's very important. So try to understand that in data gathering itself, like where is the maximum amount of time that they are spending. Advise second dose if symptoms persist after 5 to 10 minutes. Prevention and follow-up, discuss avoidance of allergens and notify caregivers in school, right? Offer reading material and arrange a GP follow-up in 1 to 2 weeks. So I'll put this into partially covered since you almost were giving that last part of information, but that's all right. Interpersonal skill, empathy, reassurance. I can see that it's very stressful for you and it's normal to feel this way. Active listening and encouragement. Do you have any other concerns or questions about what we discussed today? Paraphrase and summarize. To summarize, you will use the EpiPen if Hannah shows severe symptoms. Check understanding. Can you please repeat back to me the key points about using EpiPen? So at least do the check understanding thrice in your consultation, right? Follow-up plan, we will also schedule a follow-up appointment to review Hannah's allergy and management plan, safety netting, highlight red flags, and reiterate when to seek emergency help. Awesome, awesome. I think you did a great job, Dr. Arab, for your first try, and good job. Keep it up.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.